So we've had meetings as a department of all our partners. Two meetings so far. I think the first one was in March, the second one was in September, where we encourage partners who are working in the same space to actually sit down and see how they can craft, even begin to work together, synergize on the efforts that they are having within the county. We did this, and I'm happy to say that Jacaranda Health and ThinkWell came together, and that's what birthed, I would say, the current program that we have jointly with them. It's a beautiful way of working because it allows us as a county government and us as a Department of Health to actually participate in the creation of the program, give our input from the inception, other than sitting back and waiting for a finished product from the partners. And that way, the indicators we are looking at, the output that we are interested in, will actually come out more objectively at the end of it.
So Kenya Quality Ecosystem Project aligns properly with the Makueni healthcare component. As mentioned earlier, this is a coordination between three partners. Let me call them three partners. We have Jacaranda, we have ThinkWell, and we have Makueni County coming together to create an ecosystem of partnership and collaboration to achieve a common goal. And I think this is the very first of a kind where we have two partners seeking for a grant together and implementing with a third partner in terms of ensuring that we can improve healthcare component and health financing integrated together as one within the county, and properly helps in supporting the county in achieving its objectives of the day.
Makueni healthcare system is one of the best healthcare systems we have in the country. And the reason as to why we've been able to achieve this is because, one, the county realized that leadership is key in the provision of health services. You will take notice that Makueni has employed actually doctors as the ministers and the chief officers. And the reason as to why we do, or we try to do better than some of the counties, is because we get technical people in leadership positions. So when you have technical people in leadership positions, then it is difficult for us to go wrong.
First of all, I'm very grateful for the collaboration and partnership that we've had with Jacaranda Health. And of importance is the fact that we had a baseline data collection study or project, the facility quality assessment. And through that, we were able to interrogate into our health system to know what services we're offering, are they of good quality, what commodities we have, are they enough. Jacaranda has been very integral in providing quality healthcare reports. For example, feedback from mothers who are our biggest clients. So we're able to know if we're offering quality services, where we need to improve, what is the attitude of our staff. Yes, and also to help in evidence-based financing and resource allocation.
Okay, I just want to appreciate Jacaranda. Those are some low costs, what we call high impact, low cost interventions. They really help, and I would encourage even having so many mothers enrolled in the prompts, because they will get the information that they want, and they can also ask questions. And we also get to know about the quality of services that we are offering through the interviews that mothers are taken through during when they ask the quality questions in the prompts. So we really appreciate that, and we don't take that for granted. It has really helped us even in our programming, and also in having to know which facility needs what help.
I first knew about Jacaranda Health in 2018 when they had an MOU with the Makueni County government, and they came in to train us on HEMOC. The current maternal healthcare delivery in Makueni has improved since the trainings. The service care providers are now able to handle the obstetric emergencies comfortably. We've noted that the nurses are able now to handle the commonest obstetric emergencies like PPH, neonatal resuscitation, and another obstetric emergency comfortably.
I was introduced to the Mentors program through a training which was done to us as a group in the hospital. It was the EMOC training. After that, we were trained as mentors, and since that time we have been mentoring nurses, also other cadres in our facility. I began mentorship in the facility in July this year after our training, and I have 14 mentees that I've mentored through different obstetric emergencies.
I am a mentee, graduated 2021. What I know about the mentees is like they train any course to sharpen us. Like, for example, I didn't know about PPH, obstetric emergency, resuscitation of the newborn. Now I know. I think it is important for a health care provider to take the mentees program, so as when there's an emergency, if, let's say for example, you have a PPH, he or she can assist when you shout for help. After the training, you have handled some emergencies like PPH, you're able to shout for help. Healthcare providers were around who are also trained, which you are able to manage it. Even the resuscitation of the newborn, there's a time we had to manage that resuscitation. We shouted for help, and they are doing good.
The care which is being delivered to our mothers is going to be good outcomes, and also we as the mentors, also for them, even for the mentees, they are going to be able to mentor other people in our absence. So it's something that's going to be continuous. It will not stop now. We appreciate that Jacaranda is supporting us as a facility. It brought up the mentorship, and something that we have seen positive results with.
The quality care reports that we are receiving has benefited the facility in making decisions and also assessing ourselves on the type of services we are giving, whether our clients enjoy the services, with what to improve in delivery of our services. We've also been able to assess ourselves on whether our clients are even comfortable sharing the knowledge. And we are able to know what CMEs we need to give on maybe what we've not done well. The inspirations that the clients can draw from this mentorship is the respective maternity care in general, because they are able to see the communication and the relationship between the service care provider and the client has improved. They're able even to be accompanied by their spouses, something which was not common there before, where they're able even to be part of even their management plan and share what they require. And we can see that they enjoy the services very well.
Early this year, I had enrolled a mother who was pregnant, and through prompt, she could access information on danger signs. And when she realized that she had bleeding, she rushed to the hospital and she got treatment immediately. So she was saved, and she went through a pregnancy without any problem.
Okay, weekly I do enroll around 100 mothers per week. Monthly, that turns to around 400 or yeah. Okay, prom messages are important to all mothers since they are being enlightened on various issues and complications during pregnancy.
Proms imenisaidia kujua siku zangu za kurudi hospitali inanitumia message na inaniuliza chakula, inanitumia message ya chakula zenye napaswa kukula zikuwe balanced diet. Alafu zinanielezea nikijifungua sipaswi, napaswa kucontact daktari aniambie about family planning.
Thank you very much, Jacaranda, and we also thank the county leadership for accepting to partner with Jacaranda, because not many counties are receptive to low-cost interventions. Asante.